we have now another transformational remote patient monitoring company founded here in New York City by a Columbia MBA alum, Peter Neimi. Peter, thank you for joining us today.
Stan, thanks for having us. It's so great to be here as always. Really glad we're having this talks. It's just so inspirational to hear of all of the advances in RPM, all of this, the companies supported by HITLAB and all they're doing, and excited to be part of it and tell a little bit about our story today. So thanks again to you,
Ainsley, and
Jerry, and the whole group.
Yeah, hopefully, I mean, the audience should know you, but in case they don't, just give a 1-minute thumbnail on Recovery Plus and what you're doing.
Sure, of course. We are the home-based cardiac rehab company with a singular mission in health equity of closing the gap between need and access for cardiac rehabilitation and preventative care. We've built an FDA-listed platform that supports our work, and we have a whole team of healthcare professionals that can deliver care, deliver cardiac rehabilitation and preventative care at a home-based setting. So eliminating the need to travel and make arrangements to get to a clinic, which is particularly in rural or underserved areas, is an absolute showstopper. People just cannot go, and that's been proven over the last several decades. So we're out here trying to change that.
And again, a lot like Renova Health, everybody, Recovery Plus is helping really augment a healthcare system that needs help in this area, which is getting these sorts of programs in the home so that people don't have to travel 1-2 hours or whatever it is to their cardiac rehab center. They can do it at home. And a lot of that is psychological, right, Peter? A lot of it's behavioral. Talk a little bit about how you've infused and integrated some of the psychological support into your remote cardiopulmonary rehab program.
Sure. So clearly, physical recovery, going through a physical recovery has a very strong component of diet, lifestyle adjustments, and of course, mental health. In our field, there's an obvious correlation between suffering a health setback and depression or a mood setback. So it's very common for us to have to provide mental support and counseling with new patients. We get a lot of people coming to our program who are scared and feeling hopeless. And so we need to overcome that first before we can get on to the actual process of getting well. So a complete rehab program, it includes exercise therapy, lifestyle and diet adjustments, and emotional and mental counseling. And all of our clinical team are well aware and trained into doing exactly that.
It's wonderful. And as most people probably know, and certainly for those of you who don't, cardiac rehab is such a multidisciplinary process. We've already, obviously there's the clinical aspect now. You've infused the behavioral aspect and the psychological aspect. Talk a little bit about how you bring this multidisciplinary team to the forefront and to the patient's home.
Sure. So as I said, we've built our own platform over the course of several years. Happy to announce we just got our formal FDA listing a little earlier this year. And yeah, our team is made up of medical directors, working with our chief nursing officer and NPs, care managers, exercise physiologists, occupational therapists, and nutritionists. So it's a multidisciplinary team. Meets regularly to discuss best practice, training of new hires, and the supervising CNO reviews each patient pretty much monthly to monitor progress and ensure that the right resources are made available to all of our patients.
That's incredible. Yeah, what a really thorough job. Not surprised, considering you've done a number of startups over your career, and after graduating from Columbia's business school a couple of decades ago now. And just FYI, for those of you who don't know, just to give you an idea of how long the lab's been around, Peter was an intern with HITLAB back when he was a business school student about 20 years ago. So that is an extraordinary journey that he's been on, and just an amazing experience to have worked with him and had the honor to really see him grow and do so many great things in the startup world. And again, Peter, you talked about the journey of recovery and how it extends beyond the rehab facility. Talk a little bit more about that and how what you're doing is empowering patients of all income levels to have a healthier lifestyle and helping them kind of progress with their rehab and what they're doing there.
Yeah, so that's a critical part of the mission of Recovery Plus, right? If you look at traditional cardiac rehab as defined by Medicare, that there's an end date, right? It's typically 36 sessions conducted over the course of a few months, and then you are deemed to be done. That doesn't make a whole lot of sense in the long term. You're never done with being healthy. You're never done with living a good, healthful lifestyle. And so we've structured our program so that it includes not only exercise therapy, but remote patient monitoring. And the way that we structure the program, it can go on indefinitely. So we can keep monitoring our patients, keep in touch with their supervising physician to make sure that they achieve their recovery and maintain it for the long term. The idea that you are somehow done with any fitness program just is counterintuitive to us. And so we built our program to be for life, as it were.
That's the way to do it, right? I mean, it really isn't just about rehabbing for a month or two or three. It really is about an entirely new lifestyle that people need to integrate into their own personal behavior in order to make sure that they're going to live a much longer and healthier life than they were on track to lead. So just to wind up here, we've got a couple of minutes left. If you could provide some kind of insights about what you've learned in your journey so far, and talk a little bit about what Recovery Plus is going to be looking like over the next few years and the journey you're seeing Recovery Plus take.
Yeah, sure. A couple of things I think I'd love to highlight today, and we've been doing this. We're heading into out of the development phase. We've been in this iteration this is our third year. And you touched on the mental health and the resilience that's required to really go through a program like this, and that's a really important point. For cardiac rehab patients, when starting a program, it's really effective to focus on real-world goals, right? First of all, make them manageable. Getting out of bed unassisted, well, that's a very tangible goal. We can structure, and we do structure exercises for that. Picking up a grandchild, being able to interact with your family, really important to a lot of our elderly patients. Walking to the store, simple goal that many of our patients are scared to do. But once you can do it and get over that hump, your quality of life really will skyrocket. So by focusing on real world activities and celebrating incremental successes, we really are able to motivate our patients, get over those mental obstacles that you very rightly highlighted earlier, and really improve their quality of life in a really meaningful, recognizable way. This goes to tailoring the program. We see a wide range of patients. We work with athletes, and we work with elderly people who've had heart events. So we evaluate each patient, what they will respond to, adapt the program as they improve, as they make progress. And again, heard a lot of great talks today about what people are doing at RPM. Critical part of our program, being able to remotely monitor patients' progress, measure their progress, and be on the lookout for risk factors when they do occur, which inevitably they will. We need to be able to respond quickly.
That's wonderful, and it's amazing too, because we're obviously doing so much in digital health, and a lot of the programs and the different platforms that we test in digital health have to do with bioinformatics and certainly genomics and exosomics and metabolomics. And there's so many home-based tests that are coming out in the next couple of years that are going to allow people to see how they're doing using a simple, finger prick and send in the test and see how their overall heart and cardiovascular status are doing from a genomic and from an exosomic metabolomic level. So your program, Peter, is really inspirational. And again, thank you so much for all you're doing, not just for the U.S. healthcare system, but certainly for the digital healthcare system within that as well. Thank you. And thank you for joining us today.
Thanks for the opportunity and all that you do, Stan. We'll talk soon.
Looking forward to it.